earlier this week. I believe Albertans have done well in combating this pandemic. Through most of the past 9 months, we have had some of the lowest levels of transmission, hospitalizations, and COVID-19 related fatalities amongst the large Canadian provinces, all of the US states and the European countries. But obviously, in the past few weeks, we've seen a very worrisome spike in new cases, which is now showing up in our hospitals. We must do what is necessary to protect our hospitals so that they don't become overwhelmed. We also have to avoid canceling non-urgent surgery and other hospital medical care. That's what would happen if COVID becomes too much of a pressure and a burden on our hospitals. At the same time, it's very important that we balance the need to manage and control the spread of COVID-19 with the broader social, economic, mental, emotional, and other health considerations. We believe that the measures introduced this week strike that balance and will give us, if Albertans follow these new rules and guidelines, that we will get this under control while minimizing damage to our economy, to people's livelihoods. From the beginning, we have sought to achieve a difficult balance between protecting lives and livelihoods. Because if we were to go to the extreme position of a total lockdown, as some are calling for and other places have done, that would throw hundreds of thousands of people out of work. It would destroy, perhaps forever, tens of thousands of small and medium-sized businesses. And all of that would have huge and permanent negative impact on people's mental health, their emotional well-being, the state of their families, their ability to care for themselves, and so much more. I want to quickly run through the restrictions we announced on Tuesday after approval by our cabinet upon advice from our Chief Medical Officer, Dr. Hinshaw. Most importantly, we have banned all indoor social gatherings. I repeat, we have banned all indoor social gatherings, and it's very important to stress that that includes people's personal homes. I know this is an extraordinary measure, but we believe a necessary one, given that 40% of the traceable COVID cases in Alberta are identified with private social functions, especially at people's homes. At home, people are more relaxed. They don't wear a mask. Their families and friends, they're more intimate and closer together. They're usually sharing food and drink and embracing. Those are the kinds of activities that create transmission. And so in many of the cultural communities, there's a wonderful tradition of hospitality, of welcoming over friends, neighbors, and family. And we want to convey to the members of the cultural communities who have those great traditions that they must suspend them now. In fact, this ban on indoor social gatherings carries a fine of $1,000 for those who violate it. We banned outdoor social gatherings to a maximum of 10 people, and even those 10 people should observe the guidelines for physical distancing, 2 meters apart, and wearing masks. Funeral and wedding ceremonies must follow all public health guidelines and are limited to a maximum of 10 people in attendance. Receptions are not permitted. I know this is a sacrifice, but again, we believe a necessary one, given the intimate and emotional nature of funerals and weddings. People tend to hug, to cry, to share close space. That leads to transmission. We, as of this coming Monday, the high schools from grade 7 to 12 will go to at-home online learning. We have had very few cases of in-school transmission, but we want, but unfortunately, because of so much general transmission in the society, more cases are coming into the schools, more students and teachers are having to self-isolate, and doing this between now and the end of the Christmas break will help our system to cope while allowing grades 1 to 6, or rather kindergarten to 6, to continue. We've also extended the winter break until January the 11th to allow for a cooling off period for kids who have been around a lot of family. We have limited gatherings for worship at churches, mosques, temples, mandars, synagogues to 33%, 1/3 of the fire code capacity, with insisting that the guidelines also be followed for masking, physical distancing between cohorts, and other requirements. This allows us to balance the constitutionally protected freedom of religion with the public health crisis. Businesses are allowed to continue operating. Restaurants, bars, and pubs may stay open, but we ask that people seeking to be served be only from the same immediate household. They are also required to close at 11 and stop serving alcohol at 10. Business services, retail businesses are allowed to stay open, but at a maximum of 25% capacity. There is now a mandatory mask requirement for the Edmonton and Calgary health zones, where 83% of our cases are. Finally, we're asking for that anybody who can work from home do so now. I'll close by saying, I know that many in our immigrant and cultural communities are people who cannot work from home. I want to thank and acknowledge the critical role that so many new Albertans play in our economy. So many of the people who drive trucks that keep us supplied, work in the transportation sector, provide care in our hospitals and nursing homes, and do so much more, are taking at least some small risk now because of the COVID pandemic. We want to ensure that they have the best support and information to protect them and their loved ones at home. With that, I'd be happy to take your questions. Because of the COVID pandemic, we want to ensure that they have the best support and information.
Thank you, Premier. We will now move on to the question and answer round. There is a button called Raise Hand. It's under the participant's icon. So once the question and answer opens, you hit the Raise Hand button and I'll be able to see who would like to ask a question. And hopefully towards the end, if we have some extra time, we can take a second question. But at this time, I ask everybody to try and take one question only, please. Thank you. With some extra time, we can take a second question. But at this time, I ask everybody to try and take one question.
Hello?
Go ahead.
Okay.
Hector?
Yes, I am. Can you hear me?
I can't hear you, Hector. You must be on mute.
Okay, hold on.
We'll start with Hector.
Can you hear me? You hear me now?
Hector, hello?
Yes, hold on.
Buenas tardes, Hector.
Okay. Yes, I am.
Perfect. Awesome. You can hear me?
Okay.
Now I can.
Okay.
Bueno.
Premier,
Can you hear me?
what does it mean this in terms of economic losses? I mean, we know a lot of small businesses are closed or are is not allowed to do as a regular. I mean, they open at 10 o'clock. The liquor is at 11. I mean, liquor at 10 and small businesses at 10 o'clock. What does it mean in terms of economic? I mean, Alberta is losing money because these restrictions, and if you, Premier, have a plan to improve that economic risk.
Well, you're absolutely right, Hector, and we are concerned about that. Very deeply concerned. Let me put this in perspective. Most other provinces have completely shut small retail businesses and completely shut restaurants, bars, and pubs. And that will have a catastrophic impact on those businesses. Many, according to the Canadian Federation of Independent Business, 40% of small businesses, including restaurants and bars, may not be able to survive a second lockdown. we have been very careful in Alberta's approach to allow those businesses to stay open and safely operate. I know that the 10 o'clock last call for liquor in bars and restaurants and the 25% capacity limit in retail businesses will hurt. It will cost revenue. It will hurt those businesses. And I deeply, deeply regret that. But we are maintaining more openness for those businesses than anywhere else in Canada and most other places in the Western world, including Europe. That's because we're trying to strike a balance here. I'll also say that businesses can apply for our $5,000 small business relaunch grant. We've just renewed that program and relaxed the criteria for it. We are also supporting with the federal government the commercial rent subsidy program. We have deferred all business taxes and workers' compensation premiums and many other supports for business. But at the end of the day, we're the only province that is determined to keep those businesses open, at least within safe guidelines. Finally, if we don't get the viral spread under control, if it goes out of control, then we'll unfortunately have to look at more stringent restrictions, and people will stop going out to bars, restaurants, and stores altogether just out of concern. We want to avoid that. So we think this is, I know it's painful, and it's painful to me to think about all of those amazing small business people who are making these sacrifices, but at least they're allowed to operate here, unlike in Ontario, Quebec, and most other places.
Thank you, Premier. Next, can we take a question from Will Tigley, please?
Hi, Premier. Thanks for having us. You talked about the private gatherings and the culture of hospitality that communities have. Those who violate this will receive a $1,000 fine. My question is, how are we enforcing these fines as a government and as a community? Because I know you mentioned previously you wouldn't be doing a snitch line, but we want to make sure that our communities are safe.
Thank you. I think the most important thing is for people to look, let's face it, we cannot and will not send the police to everybody's home to see if they're respecting these rules. I suspect that the police and designated peace officers will parole neighborhoods if they see evidence of large gatherings, a bunch of cars parked outside of someone's house, that they may go to investigate. Even though the province has not set up a so-called snitch line, I do suspect that some neighbors may report aspects of concern. If a bunch of teenagers get together and start having a big noisy party, I suspect the neighbors are going to let the appropriate authorities know, for example. I just ask that everyone, and one of the reasons I'm doing this news conference tonight is to ask you in the ethnocultural media to help us inform people, especially those for who may have English language barriers, that may not be getting the direct information from the government or the English language media. You can help us to raise awareness. And I just ask everybody to make folks aware. And listen, here's a key point I want to raise. I know that in many communities, it's just normal and absolutely natural, many times a week, to have extended family, friends over. No, but you know what? If your auntie or uncle, your brother or sister show up at the door, you don't want to say you're not allowed in, but that's where we're at now. It's family gatherings, it's intimate gatherings. I know it's painful and it makes no sense, but we have to take a zero tolerance approach. So I'm not asking everybody to pick up the phone and call the police if they suspect their friends are having a party, but I am asking the community, like, if you know your neighbor's having a party, how about you go next door and say, folks, have you heard about this rule? Please, keep us safe. Please break this up. We'll have lots of chance to catch up, to party again, to socialize in the new year.
Thank you. Next, can we have Rishi Nagar, please?
Thank you, Premier. Thank you for giving us time. And the Northeast, Calgary is the hotspot now, and you have recognized as well. A majority of the residents is of the frontline workers. Is there any plan to introduce more resources for their support, sir?
Well, Rishi, first of all, let me say how much I appreciate the, as I said earlier, the frontline workers, be they in grocery stores or in the trucking companies or taxi and healthcare and so many different functions. In terms of frontline workers in, for example, the healthcare system, we have basically an open budget to support COVID response through our healthcare workforce. The province is spending well over $1.5 billion just on COVID health-related response. That includes a lot of overtime, increasing staff as much as possible. We're doing everything we can to accelerate certification of nurses, recruiting new nurses, bringing part-time nurses to full-time, bringing retired nurses back into the workforce. For example, we've also invested $170 million in support for the nursing homes and long-term care. Many new Canadians, especially women in immigrant communities, work in those occupations as healthcare aides, for example, in the nursing homes and retirement homes. And we worked with the federal government to provide many of them with a wage top-up, for example. We're looking at whether we need to do more in that particular area, Rishi, as we are trying to focus our protective efforts on the elderly frail who live in nursing and long-term care homes. So those are some of the measures we are doing to provide support for frontline workers.
Thank you, Premier. Next, we have the Latino Morning Show.
Yes.
Nayo? Now we can hear you.
Yes. Hola. Thank you for the time. Thank you for the time. And I speak by myself that I'm very happy that you see over a step forward that just the pandemic, and as you said, it's not just the economic thing, it's just the health and everything that is going to happen after this happens. So my question is, Premier, according with the Public Health Act with date of July 29, 2020, that said that you have the faculty to order the vaccine mandatory, and this is one of the main concerns right now in the population. Is your intention to do the vaccine mandatory?
No, absolutely not. We obviously hope that a vaccine can help get us through this terrible time. And the government of Canada is working with us on procuring millions of vaccines. We hope to receive enough vaccines to inoculate about 400,000 Albertans by the end of March. So in the first 3 months of the year 2021. We will prioritize the elderly and frail who tend to live in nursing homes. Then we will, as well as healthcare workers, and then other elderly people, and then we'll work out to the general population from there. But in every case, let me be clear, the vaccine will be voluntary. In fact, there is a provision in Alberta law under the Public Health Act, which has been there for over a century, that allows, that it gives the government the power to force people to take a vaccine, to make a mandatory vaccine inoculation. We will be removing that power from that legislation in February, because I want people to be absolutely clear that we are not going to strap them down and force them to take a vaccine. This is a very intimate, personal decision. We will actively encourage people to take a vaccine if it has been proven scientifically to be safe and if it is ethically produced. But I understand that some people, for one reason or another, are not comfortable with that, and we're not going to force them. But I hope enough people take it that it helps to create community immunity.
Thank you, Premier. Next, we have a question from Mr. Avneet Tejas.
Hello, Premier. Good evening. Yeah, are you hearing me?
I'm good.
Yeah. Premier, my question is that as per new restrictions imposed on Tuesday, but NDP claims that those instructions were not according to the Chief Public Health Officer, Premier Jason Kenney, hiding some recommendation, and it should be released to the public. So, what is your take on that?
Listen, my take is that we have our guidelines and our restrictions are based on the advice of the chief medical officer, but ultimately the elected, democratically accountable government is responsible for taking decisions. We are not a country where unaccountable bureaucrats get to unilaterally affect the lives of millions of people. Elected leaders must make those decisions. And those decisions that we have taken are informed in a real way by the expert advice of Dr. Hinshaw, the chief medical officer, and have been from the very beginning. But as Dr. Hinshaw herself has said, it's the government's responsibility to balance her public health advice with all of the other considerations, the impact on people's livelihoods, the economy, there's the overall health of society, the willingness of Albertans to accept certain restrictions. A bureaucrat is not well suited to make these decisions, but democratically elected people are. So I would refer you back to Dr. Hinshaw's answers to questions like that at her news conference yesterday. She's been very clear that our cabinet has respectfully listened to her public health advice. And I'll just give you an example of how we've worked together very collaboratively, okay? Just so you can, I'll give you a little bit of a peek into the cabinet room. This past week, Dr. Hinshaw recommended, and the health department recommended, that we put a 20% cap on occupancy, or fire code occupancy in retail businesses, okay? And my question was, well, do we know if that's going to create long lineups outside grocery stores in the middle of winter? We can't do that in Canada in December. I said, has anybody talked to the grocery stores? Do we know what the flow of traffic of people in and out of the grocery stores are? They said, no, we haven't done that. I said, well, please go and speak to the grocery stores and the experts, come back to us so that we have a number, a maximum capacity number, which will not create unacceptable lineups. They went and they spoke to the grocery store chains and other retailers, and they said, you know, they recommended 25%. That should be adequate to avoid unreasonable lineups. And Dr. Hinshaw said, yeah, that doesn't really make a significant difference in terms of a public health benefit. So we went with 25%. So that's the kind of creative, respectful dialogue that we have to come to these decisions.
Thank you, Premier. Next, we have Mr. Sam Nomura.
And who's the next?
Sam Nomura.
Oh, hi, Premier. Thanks very much for this being with us tonight. Premier, lots of questions. Assalamu alaikum.
Alaikum salam, Habibi.
Premier, we have to talk about worst case scenario, and let's say, what if? And we did a quick survey, and 45% of the people, they do not believe in the lockdown. 55% they are for it. So obviously, we can tell the community is kind of divided over this. What if, in worst case scenario, people did not follow orders in terms of the new restrictions? And what if the ICU beds just overwhelmed, and what exactly the government plan to deal with worst case scenarios for both cases?
Thank you. Very good question, Sam. We are going to closely assess the impact of the new restrictions, and on or around December 15th, our COVID Cabinet Committee and Dr. Hinshaw and her team from Alberta Health will meet to assess the situation, the numbers, the data. And if we conclude that these new restrictions have not had a meaningful impact on lowering the curve of viral spread, then we will have to impose additional and more stringent restrictions, as I say, in order to protect the capacity of the healthcare system. Right now, Sam, while we have 3 or 4 hospitals that are under some stress, we don't have a single hospital operating at 100% capacity. We do not have a single COVID case in 62 of the 100 hospitals in Alberta. About a dozen of the hospitals have one case or fewer. In many of our hospitals, we are below seasonal averages for ICU occupancy. So what I'm trying to say is where we stand today, contrary to some media reports, we are not running beyond capacity. However, I'll guarantee you that the cases will continue to go up significantly over the next 10 days or so, even if our measures are effective, because the numbers we see tomorrow, next week, will be people that got sick before these restrictions. Okay, so there's a lag effect, there's a delay effect. So we have to wait until that has gone through the data, gone through the system, before we can assess the effectiveness of these new restrictions that on businesses just started today, on Friday. So we'll wait until December 15. We'll make an assessment. We may have some very hard decisions to make after that. But Sam, let me just say this. We want to avoid a lockdown scenario and only leave that as a very last resort because of the huge and permanent damage it would have on so many families. Sam, I ask those in favor of a lockdown to think about this. You take a family, in the Lebanese community, for example, so many are in the restaurant business. If we shut down the restaurants, they were already shut in the summer, in the spring. If we shut them down, according to the small business groups, 40% of those businesses may never reopen their doors. The life savings are tied up in those businesses. What happens to those owners when they cannot pay the mortgage? The bank takes back the business. They lose their life savings. They lose their income that pays for food on the table. They become depressed. We've seen a spike in family violence, domestic violence, opioid and overdose drug deaths. We have a mental health crisis. So I have to balance these things off. We have to control the spread as best we can while minimizing that other damage. That's what we're trying to do.
Thank you, Premier. Next, we have a question from Amrit Brar. Amrit, you'll have to unmute.
Yeah. Good evening, respected Premier. Thank you for your time today.
I don't see you yet, Amrit, but I can hear you.
Okay.
There you go.
Okay.
How are you?
I'm good. How about yourself, sir?
Good.
I would like to know, can you put some more light on Alberta piloting rapid testing kindly, please?
Yes. Thank you. So we just announced yesterday that we're proceeding with the first tranche of the first part of our rapid test kit distribution. I think the number is 850,000 rapid test kits.
Mm-hmm.
We are distributing them initially to hospitals and nursing homes, because that's obviously where we see the most deaths and the greatest risk of infection with the most vulnerable people. Also, we want to make those available to healthcare workers and nursing home workers, because we have some workforce challenges. We need to keep nurses, healthcare aides, doctors, and others available to provide care and support. And rapid test kits is one additional tool that we can use to make sure those people are healthy and free of the virus. So that will be the initial push. The government of Canada is acquiring many more rapid test kits from domestic producers. But to be blunt, I think the federal government has done a poor job of getting approving of foreign produced test kits. Similar countries like United States, Europe, Australia have each approved many more foreign-made rapid test kits than has the Canadian Department of Health. I wish we could have access to those foreign test kits. We've been pushing for that since April. But we'll take what we can get, and right now those are the domestically produced ones, and we're putting them to use starting this weekend.
Thank you, Premier. Next, we have a question from Giuseppe. Giuseppe, you'll have to unmute. I think the mute button is just on your bottom left.
You hear me? Hello?
Yes.
Perfect. Thank you, Judy. Hello, Premier. Have a good night. Thank you for your time to talk with the different multicultural ethnic media right now. The situation is very complicated. It's not only in Alberta and all Canada. My question is regarding to so most people wait for Christmas, is the holidays. Most people, they wait for the families coming and also or they trip on their own countries. What is your suggestion? Because some people explain the board is closed. So what is your answer?
Sorry, Giuseppe, I just missed part of that. Did you say about borders?
Yeah, also.
Okay, so what's the question exactly?
The question is regarding to so most people is coming in Christmas to Canada to visit family here.
Oh, yeah.
They go over there. So what happened with the border?
Well, Giuseppe, by the way, you have the same name as the famous inventor who invented the radio, yes?
Absolutely, yeah. And also the last name.
You're Latinite. ¿Habla español o italiano?
Both, Italian and Spanish.
Ah, ¿de qué país?
In sono nato a Roma e ho vissuto in Guadalajara.
Ah, mexicano. Bueno.
Yeah.
Okay. I didn't know. Okay, so Giuseppe, the federal government, not the provincial government, controls foreign borders, and I am against. Let me put it this way. I think we need safe travel. I think the federal government made a mistake very early on in February, March. We should have stopped flights from COVID hotspots like Wuhan, Tehran, Milan. It was a mistake not to do that. But now that we're into this, I think if people who are boarding international flights can certify that they've been tested, and then they certify that they're tested upon arrival, we should facilitate that. Now, here in Alberta, Giuseppe, we have launched our pilot program at the Calgary International Airport. We're the only province to have done this. And people can volunteer when they leave an international flight at YYC to take a rapid test. They then provide contact information. If the rapid test comes back negative, and they usually get the results in 36 hours, then they can leave quarantine. So it effectively allows them to shorten the usual federal 14-day self-isolation requirement for people arriving from overseas to effectively 36 hours. They do have to check back for a second test in 7 days, just in case the virus has been latent and it begins to develop. So effectively, Giuseppe, Alberta has done better than any other province, working with the government of Canada, in making travel here simpler. Now, I do know that there have been barriers, for example, obviously to immigration, because, it's just so much more difficult to travel. And we hope that all of that will change next year. Let me offer some good news, because Lord knows we all need some good news. We are hopeful that by the end of March, we will have vaccinated the 10% of our population that is most vulnerable. And the very elderly, the frail, as well as healthcare workers. And that means that by April, we should be able to move forward significantly at reopening travel in general. So that would be my comment on the borders.
Thank you, Premier. Next, we have a question from Juliana.
Hi. Thank you so much, Premier. So my question is, those vaccines will be paid or free? And second one, I read somewhere.
Juliana, could you speak closer to the microphone? I can't quite hear.
Oh, yes, sorry. My first question is, those vaccines, they will be paid or free? And second one, I read somewhere in press that you plan to have 680,000 of vaccines for 2021. And now you said that end of March, you are planning to vaccinate 6,000 people. How many do you plan to vaccinate, like whole in 2021?
Okay, thank you, Juliana. Dobry wieczór. Dobry den. Let me say that the vaccines will be free. We will pay for the government will pay for the vaccines. They will be voluntary. The government of Canada estimates that it will receive about 6.8 million doses in the first quarter of 2021. The vaccine requires 2 doses. So 6.8 million doses means 3.4 million people. Alberta, we anticipate, will receive our per capita share of those vaccines, and that would be basically 350,000. Oh, no, I'm sorry. I got those numbers wrong. They're expecting, to be able to vaccinate 37 million people. We're expecting to receive about 400,000 people, 800,000 doses that will vaccinate 400,000 people in the first quarter of next year. So Alberta is expecting 800,000 doses, vaccinating 400,000 people in the first quarter of next year. And then for the balance of the year, I think the federal government is we don't know yet, but we anticipate that about 55% of the overall population will apply to be vaccinated. You know, so here in Alberta, that would be about 2.7 million people. So that's kind of where we're at. Those are the general numbers, but there's still a lot of unknowns.
Thank you, Premier. Next,
Thank
we have
you.
a question from Shakil Ahmed. And once again, I'd like to ask everybody to please ask one question at this time, so it's fair for everyone and we can all get in one question. Thank you.
Thank you, Premier. First of all, on behalf of the all Ethno media, I would like to say thank you. You provide the opportunity to brief about the situation in the COVID situation in Alberta. And we noticed that all the time you provide a special arrangement for the multicultural ethnic media to provide this kind of briefing or the activities. I don't have any question, but I would like to recognize and acknowledge today the government of Alberta announced a very good project for the April 2021. They announced for the physician assistant program, which is remarkable, and because we have a lot of load in our hospitals, and the physician assistant provide the same treatment or the services as the doctors. So this is on behalf of the Pakistani community and the Ethno media community, I would say this is a very good decision and, from the government of Alberta under your premiership. And we acknowledge that we need it because we have a shortage of the doctors or the physician in the bigger hospitals. Thank you.
Thank you so much, Shakil. Good to see you, and thanks for the comment and question. You're right. We are doing everything we can to maximize our healthcare workforce. And I have said to our Alberta Health Services repeatedly that we have to make full use of all of the foreign trained doctors who are working in our system but have not yet received their medical license to practice. For various reasons, they have not been able to get their residency, get their time to obtain a license to practice medicine from the College of Physicians. And so many of them are in the physician assistance program. We thank them for their assistance, for their professionalism, for their support, for our broader healthcare needs. And I have asked AHS to expand the program. And I hopefully this will help some of them get a pathway to certification as physicians in Alberta. It's a very important program. We never want to waste the tremendous human potential and talent, the experience of these foreign trained physicians.
Thank you, Premier. Next, we have a question from Deepak.
Deepak?
Good evening, Premier.
Namaste, ji.
Namaste, sir. Sir, my question is, as you mentioned that according to the new restrictions, students from grade 7 to 12, they are moving at the home learning from November 30th to January 8th. On the other side, the students from grade K to 6, they are continuing in-person learning until their scheduled winter break. So don't you think the student from grade K to 6 also, they can get the COVID?
Deepak, the science is very, very clear in Alberta and around the world that COVID-19 has no threat to the health of younger children in any statistically significant way. In fact, the normal flu influenza that goes through the schools every year, it has a more negative health impact on little children, younger children, than does COVID-19. Secondly, younger children in that age bracket have a very low chance of transmitting the virus. I should say that COVID-19 has no statistically significant threat to the health of teenagers as well, but they do have a higher propensity to transmit the virus. And so you have higher rates of transmission amongst teenagers, much lower amongst the younger kids. That's point one. Point two, because of that, more of our high schools have more students and teachers who are in self-isolation, and that is creating capacity problems in terms of the availability of both teachers and supplementary teachers. And point three, we can put the teenagers back at home without affecting parents of school-age children who are in the workforce. If we were to send back the kindergarten to grade 6 kids, then hundreds of thousands, millions of mothers and fathers would have to give up their job in order to go home and take care of younger children. And that would cause huge economic and family disruption as well. So we think this is the right approach. It was recommended by our chief medical officer. And we will, however, be extending the winter break for all of the kids, including K to 6, to give them a period to monitor symptoms after they've been around a lot of family over Christmas.
Thank you, Premier. And next we have a question from Yan C. Yan, are you there? I think Yan has stepped away from her camera. Okay, we can come back to you, Yan, and we'll take a question from Jay Chaudhry.
Hello.
Oh, it looks like Yan is back, Jay. So I'll start with Yan.
Hello, Yan.
Hi, Premier. My name is Yan Si, the chief editor of Chinese Multicultural Herald in Edmonton. We provide high-quality magazine. This is one that just published yesterday. We interviewed with Mr. Nally. Except it, I'm also a nurse working in a long-term care. My question is, countries like Japan, South Korea, and China have successfully controlled COVID-19. What measures we can learn from them to be used in Alberta to contain the COVID-19? Thank you.
Thank you very much, Yan. Back in mid-April, I gave a televised address to Albertans about COVID, and I said we must learn from the successful example of those Asian countries, including China in suppressing, but also Taiwan, South Korea, Japan to a large extent, and Singapore that have prevented. Taiwan is an example, 27 million people, less than 500 cases, and I think less than 10 deaths. It's amazing. One of the reasons I think is that those places were quick to close their borders. As you know, the Chinese government wouldn't let anybody from Wuhan or Hubei go to the rest of China as soon as they identified the virus. Japan, South Korea, Taiwan, Singapore closed their borders, their flights from Wuhan. Canada didn't. we did not act that quickly. I think those countries have more experience with infectious diseases of this nature. That's also why they had more experience at building strong contact tracing systems, supported by strong testing systems. And they also have, I think because the Asian countries have a more, let's say, hierarchical culture than the Western countries, people were more accepting of very strong quarantine policies. So as you know, in most of those countries, people who tested positive, or even those who were symptomatic, have been put into immediate government quarantine centers rather than being allowed to self-isolate voluntarily at home. Most of the transmission happens at home. And so we are trying to learn from this. And I just said to our officials last night in our COVID strategy meeting that I want us to massively expand the availability of government self-isolation in hotels where we provide secure rooms, food, medical support if necessary for people who tested positive and have the symptoms. Get them out of the homes if we can. If somebody, let's say you take a family, especially many new Canadians have larger families in smaller homes because they're often lower income. So there's a higher density, greater chance of transmission. Let's help them. As soon as somebody in that family tests positive or they have flu-like symptoms, let's make it very easy and quick for them to get into an isolation hotel where they get that support so that they less chance that they will transmit to members of their household. That is a key learning from China and other East Asian countries that have done so much better than Canada and the Western countries.
Thank you, Premier. Next, we have a question from Jay Chaudhary.
Good evening, Premier. This is Jay.
Oh my God, Jay. How are you, my friend? It's so good to see you. God bless you, my friend.
Thank you. Thank you, Premier. My question to you tonight is, what is the plan of government of Alberta should there be an overflow in ICU?
First, let me ask you, how are you feeling, Jay?
Oh, I'm good. I'm alive and I'm talking to you.
You're looking healthy, man. You've already put some weight back on. I'm glad to see it.
Thank you.
Please give my best to your family. I said a lot of prayers for you.
Thank you so much.
And I'm glad that our healthcare system gave you good care and that you're healthy and safe. Jay, the answer is that we are working very hard to expand our ICU capacity. In the spring, when we thought things were going to be a lot worse, we opened up 2,400 designated COVID hospital beds, of which 650 were ICU beds. And we're going through a similar process now. We're being a little more careful in how many we open up all at once, because at some point, every additional bed we set aside is a surgery we've had to cancel or someone else's non-COVID healthcare we've had to delay. So we're doing a very careful balancing act. Our professionals at AHS are very carefully monitoring the COVID numbers to open up extra set-aside capacity as necessary. As of today, we have 86 COVID patients in ICU, and that's in a system where we can have, upwards of 1,000 ICU beds. We are well below ICU capacity in almost all of our hospitals. We are a little bit concerned about the pressure on a few hospitals like the Peter Lougheed, Calgary South Campus, Royal Alec, University of Alberta, the big urbans. But we have a lot of other hospitals that are below seasonal capacity. One of the reasons for that, Jay, is that our regular influenza numbers have almost disappeared because of all of the distancing and hygiene and public health measures. Far fewer people are showing up sick with regular flu, and We also, at least in some emergency wards, are seeing below average numbers of patients just because, like in the spring, people are moving around less, fewer car accidents, etc. So right now, the information I have from Alberta Health Services is that we're able to cope. The concern is not where we are now, but where how the cases turn up in hospitals in the next 2 or 3 weeks. And so, as I say, we will continue to open up more beds. We can open up as many as 650, I believe, set aside ICU beds for COVID, and we're less than 1/10 of the way. Well, we're at about 1/8 of that number now.
Thank you, Premier. Next, we have a question from George Romberg.
Hello, Premier, how are you?
Jorge.
Jorge, sí, señor. ¿Cómo está?
Muy bien.
Muy bien. Good. Now, first of all, many of the questions I had prepared for you, somebody else has asked, so I won't take much of your time. But the first thing I want to say is, as you may know, I am a tour operator, wholesale travel agent. One of those small companies that has suffered tremendously with this situation. And I want to congratulate you or whoever made the decision of having this pilot program in Calgary. Is wonderful, and I think it's a brilliant idea. Also, on the same subject, I would like to thank you from deep in my heart, and I'm sure you understand I'm talking for many other people, for not agreeing to the pressure of the full lockdown, which would have caused an absolute disaster in this province. We're already suffering a lot from many other things. So congratulations and thank you. I also had an opportunity, or I have been having an opportunity to talk to your ministers. You have a wonderful team of people working, and I'm very proud to have you people as you personally and your team as our government. My other question is, I think I understood that 2, 3, 4 weeks ago, there were already some quasi restrictions in some kind of points of attention, and yet the numbers of infections have gone up tremendously. What do you feel? What's your feeling, or your team's feeling? What's going to happen? Why are numbers in Alberta going up so dramatically? What is happening?
Thank you, Jorge. Well, they're going up in most parts of the world, certainly the Western world, Latin America, Europe, North America. And we expected this. Infectious respiratory diseases of this nature always go up as the weather gets colder. It's why we always talk about this as flu season. People move indoors rather than spending more time outdoors, where there's a airborne virus like this does not really transmit very well. They move indoors into closer spaces, and also the cold temperature can make weaken people's immune systems as well. So we've always seen an increase in viral spread with diseases like this at this time of year. That's point one. Point two, in Alberta, what we have seen is the largest so-called vector of transmission by far is social activity at homes. About 40% of our traceable COVID cases in Alberta have come from social activities, indoor social activities, largely at people's private homes. And what's happening there is, I think when people are with family and friends at home, they let down their guard. They're not going to wear masks. They're not going to sanitize their hands constantly. They're not going to sit 2 meters apart from one another. They're going to hug and shake hands and kiss and share food and share drink in the living room, in the kitchen. And that is a perfect condition for spreading the virus. That is why we took a targeted measure to crack down hard on at-home social functions, rather than the indiscriminate approach of shutting down the entire economy, which would also not just hurt people's financial well-being. In turn, it would hurt their health and lives as well. And so I think we've taken the right approach. I certainly hope so. I hope the numbers will bear this out. Anything you can do to convey to the Hispanic community that this is not a joke, that they have to stop, like everyone, at home socializing, even with family and friends. And in the meantime, use the fact that we've kept businesses open. Go out and patronize our local businesses. Go out and patronize the local restaurant with your family. Go out and buy your Christmas gifts, not on Amazon or in Walmart. Go and support the local small businesses when they so desperately need it.
Thank you, Premier. Next, we have a question from Jagdish Dylan. You'll have to hit unmute.
Hello, Premier. Good evening. Are you able to hear me?
I am.
First of all, thank you for giving us the time. And coming straight to the my question. On one side, we are saying that we don't want to treat the path where we want to make vaccination mandatory, because you just mentioned to one of my media friends' question that that's not that you are going to follow. So is it not a situation where 50% of Alberta says yes, we will go for the vaccination, and 50% says we will not? So will that not be a very, very dangerous situation under all circumstances? And second, if we are having the vaccine, how confident are we that the vaccine that we are going to have is has been developed and brought out, rolled out with all the necessary tests and proper process has been followed on that case?
Thank you so much, Mr. Dillon. Good questions. First of all, we would only distribute a vaccine if it has been proven by multiple trials to be safe for human use. And that in part will, Health Canada has to certify that, as will our own Alberta Health Services. There are 3 current major vaccines that have gone through extensive trials and have initially been deemed to be safe with over 90% effectiveness. Those are Pfizer and AstraZeneca, and I keep forgetting the other. I'll get you the third name. They've all tested at over 90% effectiveness with no statistically significant negative side effects. And I understand there's a consensus that they've all been ethically produced. Secondly, your question about what percentage do we need to protect the population? Scientists have different opinions on that question. Some have said they believe if we get 35% inoculation, that is sufficient to achieve what epidemiologists call herd immunity or community immunity. Others say we need closer to 60%. But Mr. Dillon, here's the important thing. Once we have vaccinated the vulnerable, we have changed the whole game, because the average age of COVID fatality is 82. That's the same as the average life expectancy in general in Alberta. I believe over 80%, I think over 85% of our COVID fatalities in Alberta are people 70 years of age and over. 97% of them had at least one other chronic health condition. And in fact, I think 76% of COVID deaths in Alberta had at least 3 other so-called comorbidities or chronic conditions like dementia, hypertension, pulmonary conditions. So my point is this: we know who's vulnerable. It's not healthy young people. Yes, the odd one has died, but not in a statistically significant way. It is the elderly vulnerable, especially those living in congregate care facilities like nursing homes. If we can vaccinate them and vaccinate the healthcare workers, and that will be the first sort of 10%, we will be in a totally different game. And after that, yes, it's about controlling viral spread. But once we've vaccinated, and the three are Pfizer, Moderna, and AstraZeneca. So there you go.
Thank you, Premier. Now we have a question from Tehran.
Good evening, Premier. First of all, can you hear me?
I can.
Yeah, good. Thank you. Yeah, I am from Somali Media, Edmonton, and I'm very much happy to participate in this briefing, COVID-19. I know, first of all, I know it's very tough time for you, for me, and for everyone in Alberta because of COVID-19. Recently, government of Alberta announced new restrictions, but according to that restrictions, some of the community, they even don't understand, and they have communication barrier, and still some of them, they don't understand what the government of Alberta has said or what kind of message. So my question is, what is the easiest way can community get the message from the government? So how can how can the government can reach throughout the community? Because some of them, they have communication barriers. That's my first question.
Yeah, you know what, Mr. Aiden, you're asking a critically important question. That's one of the reasons I'm doing this news conference. Let me be very blunt with you. We have the Black community across the province has a much higher level of being affected by COVID than the overall population. And some of this, there's a lot of reasons. I think a lot of folks in the African community work in frontline positions. They're more exposed. But also, you just pointed out that there may be language barriers and other communications challenges. It's very important that we get the message out. Anything you can do to help us with that. We are trying to advertise in minority languages, other than English and French. We are trying to advertise in those languages as much as possible. We would be happy to produce literature, like if in your case, in the Somali language, that could be distributed to Somali homes through perhaps Somali organizations. We just sent a blast text message to every cell phone in Alberta about 24 hours ago, but unfortunately, of course, that's in English. Any advice, I keep telling our officials that we need to do a better job, especially in some immigrant communities where there are language barriers, and any advice you have, we would accept very much. And so, in fact, I'd like to do a separate call just with leaders and media from the African community in Edmonton, because that's the community that's facing the greatest impact from COVID right now.
Thank you, Premier. Next, we have Fina. Fina, I don't see the raise hand icon, but would you still like to ask a question? Fina? Okay, I'll come back to Fina, and I have Teofila. Would you like to ask a question? I don't see the raise hand icon near your name either. You can just hit unmute at the bottom left, Teofila.
Okay. Okay, my question is, it's on the restaurants that you can only go with the same household. But what happened is, how about if there is a birthday party and you invited people, but of course you have the same household in one table, but different friends and families on different tables. So how can you do the restriction on that matter?
Yeah, thanks, Teofila. Here's the rule, just to be simple. Restaurants and bars, pubs can serve people limited to tables of 6. And we are asking that only people who live in the same household dine together, because we're trying to stop all indoor social activity. And so if you have more than 6 people in your household, go and get 2 tables. You can have 2 tables in the same part of the restaurant. Also, if you're single, you can go to a restaurant with 2 close contacts that you have designated. So those are the rules. I know it's a hassle, it's an inconvenience, but it's a heck of a lot better, Teofila, than shutting down the restaurants like everyone else has done in the rest of Canada. We've kept them open. It's a lifeline on business. Obviously, they can do takeout sales, delivery. We also allow them to sell their liquor inventory online, and they can do that after 10 p.m. And they can continue to have family groups come in and sit at a table, maximum of 6 a table. I know it's going to hurt, but it's a lot better than the alternative, which was shutting down the restaurants altogether.
Thank you, Premier. I'm going to try to have Fina on again. Fina, can you hit unmute at the bottom left?
There we go. Yes.
Thank you.
Can you hear me now?
Yes, we can.
Okay. Thank you so much, Premier, for doing this. I know I look like a masquerade right now because I'm in the store. I had to run in before the store closes. Do we really know statistically why the African community is more affected on this pandemic than any other group? Do we know the scientific reasons behind that?
No, I don't think there's a scientific reason, Fina, not that I've heard. And here's some good news. According to Dr. Hinshaw and our health experts, minority communities, including the Black community, are not having worse health outcomes when they get COVID. In other words, they're not more susceptible to becoming very sick or dying from COVID. It just seems that there is higher levels of viral spread in some communities, and the Afro-Canadian community in Alberta is at the top. And I think that has to do with a couple of things. You know, we have a lot of Afro-Canadians who work in the meatpacking plants that got a big outbreaks in the spring. A lot of folks in the community work out in the front lines in service industry jobs, so they're more out in the general population. And thirdly, because a lot of Afro-Canadians are very new Canadians, many of them are refugees, like many from East Africa, for example, and therefore they tend to be lower income households. And that means smaller houses, more density. So it's a social economic factor, which is to say, let's say you're a new refugee family from East Africa. Maybe you're living in a family of 5 or 6 in a relatively small apartment with 1 washroom. Those are very higher levels of transmission than for other people that have had the advantage of more financial security, larger homes, more space, and less housing density. So I think those are some of the factors. But what we need the community to do is work with us and with everyone on suspending at-home social activity. I know that the Black communities have a beautiful tradition of hospitality, and that's a great part of many different Afro-Caribbean cultures. But at this point, we all have to just say no visiting, no socializing, even with family and friends, unless they're in your household. And we are going to offer people, especially those who might be from lower income families, an opportunity to get into hotels if they need to self-isolate, but they cannot do it at home.
Thank you, Premier. I think we had Ranjit Sidhu here, who was the last one left with a question, but I think he may have left.
Hello.
Let me just give me 1 second here. Okay.
Hello.
Ranjit?
Yeah, I'm here.
Oh, you're here.
Thanks, Premier, for this meeting. And my question is a little long and it's related to trucking industry. As you mentioned earlier, trucking is a essential service, especially in a COVID time. few weeks ago, Alberta government freed some foreign workers categories, and transport is also included in this categories. Right now, what Albertan trucking companies doing competition with BC companies, Ontario companies, and other province companies. So their foreign workers policies are open, BC, Ontario, and other provinces. So they can take loads from Alberta. So how we can compete with the BC and Ontario companies if they are allowed to hire foreign workers and Alberta trucking companies not allowed to hire workers. I met some trucking companies. I also run a small trucking company. Some trucking companies thinking to move their head office from Alberta to BC and Ontario because they can hire foreign workers. What do you think about it?
Well, what I think is that the temporary foreign worker program is a real problem in the midst of the worst recession in a century. We have 300,000 unemployed Albertans, and they're telling us very clearly, including immigrant Albertans, new Albertans, that they want to have the jobs available to them rather than going overseas. And surely at the highest levels of unemployment in our modern history, we can work hard to find more people to go into trucking here in Alberta. We value the important work that truckers do. They've demonstrated how important they are to our society over the past 9 months, keeping our supply chains open. We will be launching in January a big new job training program to take people who are unemployed and offer government support for them to get trained up for available jobs like trucking jobs. There are a lot of people from the oil and gas sector who have lost their jobs driving trucks, driving heavy equipment, heavy implements. They are good candidates to go into the industry. I would also say with international travel restrictions, it's virtually impossible to bring people in here even as temporary foreign workers for the time being anyway. So like I say, I think it's important for employers to do everything we can during this economic and jobs crisis to train and recruit Canadians who are available, including new Canadians who arrived here only in the recent years and are facing very high unemployment.
But the problem is, like, if the other provinces are allowed to hire the foreign workers, if the only Albertan companies are not, how Albertan companies will compete? Because if someone running a company in BC, they can take loads from Alberta, they can run a business from here, and they have.
Well, I would say the difference is we have much higher unemployment than Ontario and BC, and so we have to set our policies to respond to the priorities of Albertans and the economy in Alberta. So I would be very surprised if there are any temporary foreign workers coming into BC or Ontario right now because of the travel restrictions around COVID.
Thank you, Premier. And this concludes our Zoom roundtable for the evening. Would you like to say any closing remarks?
Yes, I want to thank everybody for their really good questions, Jyoti. I'm serious. Those were thoughtful, on point, very relevant questions. I hope you all understand what difficult decisions we have to take. There are no easy answers to this. It's very, very difficult to balance off lives and livelihoods, preserving capacity in the healthcare system while respecting fundamental rights and freedoms. And I just ask for your patience and understanding as we go through this. Finally, all of you truly have an important role to play in our efforts to defeat COVID in Alberta, partly because it has affected immigrant communities more than the general population. And many folks in those communities do have language barriers, as Mr. Aiden pointed out. And you can help us to provide accurate, life-saving information to your communities in their languages. And that is a very important public service. We are trying to increase our advertising and ethnocultural media as well to convey these messages. If your outlets are not benefiting from that advertising, please let us know, as I have instructed our officials to significantly expand advertising and ethnocultural media. So with that, thank you very much. God bless you all and have a very good weekend.
Thank you so much, Premier. I'd just like to say one more thing. Thank you to all of our outlets for the great work that they're doing during this time. There will be a recording of our Zoom meeting from tonight. I'll have the tech team work on it tonight. I know a lot of you have shows early in the morning and you'd like to play the clip right. And if you'd like to book any meetings with ministers, please reach out to Danelle Murray.
Bueno, esa fue la conferencia de prensa que el Premier Jason Kenney pues ha ofrecido a los albertanos. Y bueno, estamos muy complacidos porque finalmente pues está tomando en cuenta a los medios de comunicación que somos minoría, en este caso como él lo decía. Y bueno, pues recapitulando lo que el Premier Jason Kenney nos decía, es que pues hay que tomar las restricciones que en serio, las que el gobierno de Alberta está ofreciendo. Y también únicamente recordar para aquellos pequeños negocios, aquellos propietarios de los pequeños negocios, pues que hay programas para que ustedes puedan acudir y puedan, programas económicos para poder expandir pues esta crisis económica que se viene por las restricciones y por los cierres, ¿no? De alguna manera que el gobierno de Alberta y que el Premier Jason Kenney pues está ofreciendo. También recordando lo que él nos estaba comentando, tiene 200 camas adicionales también de cuidados intensivos para atender la demanda si es que así fuera necesario, si es que este virus pudiera esparcirse un poco más. Bueno, está poniendo 200 camas adicionales en cuidados intensivos para aquellas personas que lo requieran, como ya dije, si es que esto pues se propagará más de lo que ya está. También él dijo en la conferencia de prensa que pues las vacunas serán de manera gratuitas y también que no tendrán ningún costo. El gobierno de Alberta estará comprando y estará ofreciendo las vacunas para el COVID-19 de manera gratuita y no serán obligatorias. El Premier Jason Kenney lo informó y lo dijo hoy que no serán obligatorias. Simplemente van a ser vacunados quienes tengan pues el deseo de hacerlo. Esa es una cosa importante porque se ha venido manejando en algunos medios de comunicación y alguna gente ha estado manejando que pudiera ser obligatorio, que pudiera ser algo mandatorio, como así lo dicen aquí. Bueno, también estuvo hablando acerca de, pues, si por alguna razón aquellas personas no pueden autoaislarse, el gobierno de Alberta también proporcionará soporte para pagar el hotel de aquellas personas que vivan en casas pequeñas o que sean de un bajo income. Bueno, el gobierno de Alberta podrá ponerlas en hoteles o en casas para que pues puedan así protegerse y proteger también a su familia. Esas son decisiones muy importantes que el gobierno de Alberta, que el primer Jason Kenney está ofreciendo. También habló de un programa porque habla de que hay 300 desempleados en Alberta, que se me hacen muy pocos, yo creo que hay más, pero bueno, ese fue el número que dio el Premier, y dice que en enero también va a haber un programa para hacer entrenamiento, va a ofrecer entrenamiento a aquellos desempleados para que puedan encontrar trabajo y bueno, de alguna manera pueda recuperarse la economía de estas personas. Así que, bueno, puntos importantes de los que habló el Premier Jason Kenney, lo repito, el impacto económico que esto va a tener, las restricciones, afortunadamente va a inyectar dinero la provincia de Alberta para los negocios. Hay programas para que puedan acceder a la cuestión económica y puedan de alguna manera pues sobrellevar esta crisis. También habló acerca de las vacunas van a ser gratis. Eso es importante, va a ser gratis, no va a tener ningún costo y no van a ser obligatorias, que también eso fue lo que informó. También está alentando a todos a que sigamos las pautas, las restricciones, todo lo que él nos ha dicho, que si no tenemos que pues convivir, pues que no lo hagamos, ¿no? Porque de esto depende que en 3 semanas esta restricción siga o se relaje un poco. Las 200 camas adicionales que está ofreciendo también el gobierno de Alberta para aquellos que lo necesiten, si es que fuera necesario para el cuidados, la unidad de cuidados intensivos. También habló acerca de si es que una familia puede ir solo a un restaurante o algún bar a comer. Bueno, dice que son 6 personas por mesa únicamente. Lo más que pueden convivir son 6 personas por mesa, pero sí, efectivamente tienen que ser pues miembros de la misma familia. Bueno, a grandes rasgos, esto fue de lo que habló el Premiere Jason Kenney, a quien agradecemos también por tomarnos en cuenta y por informar a la comunidad latina. Si por alguna razón ustedes no pudieron escucharlo o no entendieron algunas cosas, bueno, aquí estamos. Háganos saber su pregunta y bueno, vamos a tratar de contestarla porque, pues, como ya lo dijo, va a estar ofreciendo este tipo de conferencias de prensa para que, pues, ustedes de primera mano obtengan la información y nosotros pues vamos a tratar también de dárselas ya un poco más digerida y más rápida para que ustedes puedan tener acceso a esta información. Bueno, por mi parte no me queda más que agradecer a todos ustedes el favor de su atención. Gracias por seguirnos, gracias por estar conectados en esta transmisión en vivo. Yo soy Héctor Chaparro y les agradezco que estén en esta plataforma digital Canadá Latin Channel, donde miércoles a miércoles y cuando así lo hiciéramos también o cuando así el gobierno haga conferencias de manera esporádica y especiales, vamos a estar trayéndoles a ustedes la información de primera mano de la gente que realmente lo está ofreciendo. Gracias. Les deseo una muy bonita tarde, muy bonita noche a todos. Gracias por ser parte de Canadá Latin Channel. No se olviden poner su campanita de notificaciones en YouTube, seguirnos en Instagram, en YouTube, en nuestra página web www.canadalatinchannel.com. Gracias, bonito viernes. Hasta luego. Estás en Canadá Latin Channel, información en tu idioma.